Thank you to all those who have joined us today. Just a couple of bits of housekeeping and warnings before we jump into the main presentation today. Number one, unfortunately, I've got some really adverse weather where I am. I've got quite a hailstorm and some thunder going on, and I've had a pop up saying I've got low bandwidth as a result. And so, if there is any issues with sound or image throughout the presentation, most likely it's going to be as a result of some of that adverse weather. So apologies in advance if it does affect the quality of today's broadcast. Secondly, just as a bit of advanced warning as well, my wife is very, very close to giving birth, and she's not, but if for some reason I do have to jump off during the presentation because things suddenly move along quickly, we have pre-recorded this session as well, and so a recording will be sent out to you in a slightly reduced format to ensure that you don't miss out on the content of the day. Otherwise, welcome to everyone to today's session. My name is Dale Tomlinson. I'm a Senior Customer Success Manager here at Thrive and have been for the last half a decade, and with a particular interest in supporting our customers in building mental health ecosystems that work. That's a really big part of my role as a Customer Success Manager. Is not just promoting tools, it's helping the overall mental health conversation within organizations. And so the purpose of today's meeting is to really kind of distill some of those experiences over the last 5 years, working with some of the UK's biggest companies and working across major insurance schemes and providers to illustrate how we think this can be done really effectively, how an effective mental health ecosystem can be built. Before we jump in, I'd just like to remind you that the chat function is available, and if you do have any more direct questions, the Q&A is available as well. Please do feel free to use the chat at any point to share your view or chat through with each other, and it would be great to see ideas being shared as a part of today's presentation. We're going to jump straight in with a Slido. If you've never used Slido before, it's really straightforward. All you need to do is scan the QR code on screen, or go to slido.com and type in that access number, which is 2118784. And it's just a quick temperature check, really, for our attendees today, which is what are you hoping to get out of today's webinar? And a few options. Number one, to get ideas for how to promote mental health services more effectively. Number two, to understand some of the barriers to accessing support through the workplace. Number three, to glean ideas for building and evolving a mental health and wellbeing strategy. Or number four, because I just love Thrive webinars and thought I would sign up. It is multiple choice, so you can select more than one if more than one is relevant. And already, yeah, thank you. We've already had nearly 24 jump in. Number one so far, to glean ideas for building and evolving a mental health and wellbeing strategy is kind of leading the pack there. 14% of you just love Thrive webinars and thought you'd sign up anyway. You are very welcome. And hopefully along the way, perhaps some of these other points may be absorbed as we go through. But I'll still let the last few results come through. To get ideas for how to promote mental health services more effectively, creeping up in number two. And number three, to understand some of the barriers to accessing support through the workplace. Brilliant. We will move on from that poll then. Thank you for giving me a bit of vital data today to understand my audience, understand what's going to be most important to you guys. And so, I can get my formatting right. 2 number 4s, you see I've already missed something there. Today's agenda, we're going to focus as follows on the prevalence of mental health issues within the workplace, understand how that impacts the workplace specifically, understand why rates are going up, understand why perhaps the services we've invested in aren't quite making as much of a difference as we would like. We're going to look at how we can bring some of our mental health services together, and finally support and talk through how to build an effective engagement strategy for promoting mental health services. And then, which I have missed off on the agenda here, tacked on at the end, is a brief demonstration of the Thrive service, and in particular how it can play a role as a cog within this mental health ecosystem. So to start with, probably figures you're well versed in at this point if you've come to Thrive sessions before, or if you're heavily involved in this workplace mental health and wellbeing space. The demand for workplace mental health support is not diminishing by any means. In fact, year on year for the last 10 years, the scale of impact that mental health has on the workplace has only increased. Research by Deloitte tells us that last year 22.1 million working days were lost as a result of mental ill health. If we're looking before the COVID pandemic, we were looking around 16 to 17 million. So that's quite a significant jump in working days lost in the last 5 or 6 years as a result of a range of issues that we're going to touch on today. In terms of an economic cost, that's put around £52 billion to the workplace. In combination of absenteeism, presenteeism, and people leaving their roles as a result of a mental health condition. That's not even getting into the public health sphere and how much treatment costs, the impact on community, families. And so, we're talking about a very specific measure here, which is the cost of the workplace, but we know the cost to the broader community is even more significant. But moving away from the financials and the monetary cost, the human cost of this is significant as well. And one of the reasons this happens, one of the key reasons why the cost is so high, is partly because of what I like to call the demand services gap. That here in the UK, we understand, thanks to research from Mind, from HSE, from a range of public health providers, that only around 1 in 6 employed people currently have a mental health condition, or at least symptoms of which, should they speak with somebody who has the capacity to diagnose, would likely be diagnosed. In the general population, that sits around 1 in 4, but in the employed population, around 1 in 6. Of those 1 in 6 who will have a mental health condition during this year, estimates suggest that around 25 to 33% of those people will seek help, which means that on the other end, 75 to 66% will never seek help for that issue. And the reasons for that, will be things you're probably well versed in by now: a lack of awareness, culture, stigma, low accessibility to services. Of those who do take that step to seek further support, so of the 25 to 33% of the 1 in 6, less than half of them will actually speak with a therapist after reaching out to the NHS or a typical EAP provider or other mental health service that they might have access to. And so, as you can see, the fractions are going down here. We started off at 1 in 6 unwell people, and then of those, around 1 in 4 to 1 in 3 seek further help. Of those, around half actually get access to therapy. And of those in therapy, typically speaking within the NHS, around 50% of them will recover and 50% of them will be discharged without a full recovery. And so hopefully that demand services gap summarises the issue really well. That we have quite a large number of people with mental health conditions. A significant number of them will never seek help. Of those that do seek help, a significant number won't land in the right type of help. And of those that do land in the right type of help, only half of them will fully recover as a result. So in terms of the scale of need, we're only scratching the surface in reality. Now, the most common mental health conditions that impact the workplace tend to be along the lines of anxiety, depression, or mixed anxiety depression. In around 50 to 60% of cases, we find symptoms of both within an individual. What we know as well is that in those cases of comorbid anxiety and depression, the need for more severe intervention, medical utilization, longer term interventions are needed. That there is usually a higher level of severity, that recovery tends to be slower. There's a requirement for more therapy sessions than would be typical in isolation of anxiety or depression symptoms. There's a higher likelihood of relapse and recurrence. And as a result, there's a higher likelihood of that person exiting the workforce either temporarily or long term. Now, one question I've been asked many times is, we've got a much greater awareness of mental health than it's ever been before. We're not actually that long ago since, in the grand scheme of human history, the hundreds of thousands of years we've existed as a species, we're not that. It's not been that long since the way mental health was seen was, heavily prejudiced. We're talking 50 years or so since, well, maybe slightly longer than 50 years since, the standard thing for someone who was seen to be mentally ill was to be put into asylum and to be, housed within an institution, freedom taken away from that individual, dignity loss. We're only a few hundred years since things like witch trials and accusations, of the paranormal nature when it came to mental health issues. And so, considering that, we have come an incredibly long way in the last few hundred years, but in particular over the last 2 decades, in terms of awareness and stigma, we've taken significant bounds forward in positive progress to recognizing mental health conditions, kind of divorcing the idea that a mental health condition summarizes the worth of an individual or the functionality of their personality, whatever it might be. And generally speaking now, most people, when they talk at least about other people having mental health conditions, are much more open, much more supportive, and more willing to signpost and help people access help. And so what's interesting is with all that in mind, these rates are going up still. That with more awareness, with theoretically more help available, and more support within the general public, rates are going through the roof. And so there's a number of reasons why that's happening. First of all, there's this idea of self-fulfilling prophecy. The more aware we are of mental health conditions, the more people are likely to have them, partly because people would have suffered in silence in the past, where maybe there wasn't clinical language to describe their experiences. Perhaps they just simply weren't aware of mental health as a concept, or as they knew they had problems with their mental health, but didn't feel comfortable enough to talk about them and never spoke to a clinician, never completed a mental health assessment. And so we just didn't uncover those issues. And so there's an element of greater awareness shines a light on an existing problem that wasn't being reported, and that certainly does contribute. However, there's a range of other issues that we see, in particular within the workforce, that are driving this. Number one being that our collective health is worse, generally speaking, as a society. Even though life expectancy, generally speaking, has gone up over the last 50 years, the likelihood of having a managed health issue has also gone up. And with that, we know that with chronic health conditions, there is an increased likelihood of experiencing a mental health condition as well. We also know that it's not uncommon that symptoms of some of these chronic health conditions can cross over with mental health condition symptoms, and therefore issues could be unreported as well in the past, whereas because we're now able to kind of separate these two things out a bit more cleanly, what may have just been ignored before as a symptom of a physical health condition is now being recognized as a condition in its own right. Secondly, technology has fundamentally changed our lifestyles, especially over the last 30 years. As a result of technology, and I'm not here to say technology is fundamentally bad, and I'm delivering this webinar through technology. We deliver our services here at Thrive through technology, so I don't need to think that this is a call for us to go back to analog life. But certainly technology has created major changes in the way that we live. And some of those changes are immensely positive, but some of them can also be immensely negative. There's certainly higher rates of sedentary behavior. A decline in sleep length has been significant. I think research came out this year to show that for the first time, the average length of sleep in the UK is less than 6 hours for adults, where we need really between 7 and 9 hours. And so decline in sleep length and quality, partly driven by technology usage and overconsumption, higher exposure to kind of the negative and harmful content that we can engage with, addictions to consuming content or to games or to whatever it might be, but also transforming the workplace. Kind of this idea of being always on, always reachable, being able to check in on your emails even when you're on annual leave because you hybrid work and your laptop's at home, and not fully being able to escape that stress the temptation to work longer hours to try and get ahead. All of these things have, fundamentally changed the way we live, as well as the pace of change within the workplace, right? So rolling out new pieces of software, all I seem to hear right now on LinkedIn and everywhere is AI this and AI that, and how it's going to fundamentally change the workplace again. The stress of keeping up with these new technologies and skills, again, fundamentally changed how we interact in the workplace. Shame and stigma are still, major challenges to getting people to seek further help, and certainly within the workplace themselves, these challenges can be exaggerated and more and a different dynamic to perhaps disclosing to a friend or a partner, with the recognition that most people do feel uncomfortable talking about health generally. Data suggests that kind of the most uncomfortable things to talk about would be seen as reproductive health, mental health, and weight-related issues are seen as the most uncomfortable health conversations to have. And so mental health being in the top three for a number of reasons, right? Partially because of maybe feelings of shame, embarrassment. Within the workplace, this idea of wanting to appear competent, trustworthy, able to be considered for that promotion. And self-imposed worries about how people would perceive you if you were to disclose a mental health issue, and the role it could play in your career in the future, your reputation. Fear of gossip and other people talking about your health, which nobody really wants, do they? And so this certainly, again, is a challenge to getting people to seek help from the outset, certainly. And lastly, the last kind of major one that we see is negative past experiences when someone has sought help. And actually, people are often not taking those steps to seek further help, partially because they've tried in the past. Maybe they disclosed to a manager, to a friend, maybe to their GP, and felt that they didn't get heard. They weren't able to reach services. They were one of that 50% who took that step, and then the door slammed shut on them. Maybe it was long waiting lists. Maybe it was treatment that wasn't personalized to their needs, and then being discharged without actually progressing and having a negative experience, perhaps with intervention in the past, making that individual feel that help isn't worth trying to get. And so these are significant challenges to convince anybody to get help for any condition, but especially a mental health condition. From conversations that we have on the ground at workplaces, at events, there's a lot of perceptions that people have about disclosing a mental health condition and seeking help for it. Many people feel, from anecdotal conversations I've had with people across all sorts of industries and walks of life, there is this difficulty getting over the idea that a mental health condition is just a health condition. They're struggling to accept that, partially because it's their mind and they feel that their personality and sense of self and self-esteem and self-worth sits within the same place where this health issue is. And so there's this struggle to grapple with the idea that is there something wrong with me as a person, and admitting to a mental health condition can drive some of those thoughts, which we of course know is certainly not the case, and that a mental health condition is a health condition. It can be treated, it can be supported, and isn't connected to somebody's self-worth or value. And so how do we then tackle these challenges in the workplace? What can we do to ensure that these big issues that turn people off seeking help or make it harder to access support are taken care of? How can we remove these barriers to empower the 75% to 66% of people who don't take that initial first step to seek help? How can we empower those who take that step and then feel that it wasn't the right step and the right help wasn't delivered? Or those people who do go through the help and leave feeling that they haven't improved? How can we tackle these challenges in the workplace to ensure that these challenges are minimized, that we can get ahead of these mental health challenges, and that we can have a healthy, happy, and well taken care of workforce? Now, I'm going to run through a range of ideas for you. And I would love to, interactions in the chat. There's a Slido coming up as well. But for me, these kind of falls into four categories. Number one, are the decisions to invest in services or wellbeing strategies being driven by data, first of all? Secondly, do services and the strategy made cover the needs of the workforce? Number three, is psychoeducation and prevention promoted within the workplace? And number four, is access to services built into the systems that employees are actually going to access? So four key questions that I've learned over the years of playing this role as a supplier to organizations looking to tackle these challenges. And so I'm going to drive us into a Slido now again. And I'd love for you again, QR code or type in the access code on slido.com. And this is an open word cloud, so please put in free text what you feel your answer would be. But the question is, what sort of data would you need to know about your workforce to build a mental health ecosystem? Okay, first one through. I'm guessing that was absence, but you were so eager to be first that there was a slight typo there. So I'm going to go with the guess of that. It says absence data. Absolutely. Absence trends. Absolutely. Really key to understand that key metric of people not engaging in the workforce, having to leave the workforce temporarily. Okay, I'm going to let a few more come in, but certainly the absence data point is a key one. Here we go. It's starting to come in on my screen now. Diagnosis of conditions. So if you have an internal or external occupational health provider, for example, are they able to pick up on some of that as a part of OH functions? Avoiding tasks. So certainly behaviors within the workforce, right? Looking at whether it's performance analysis outcomes, and performance is coming up there in big and bold. Performance as a business, performance on individual levels, whether it's in one-to-ones with managers, whether it's team, whether it's looking at KPIs achieved, looking at if there's ability to look at behaviors within the workplace, whether it's CRM is being neglected, whether it's goals are not being hit, changes in attitude and ability, absolutely running close to performance. Mental health, mental health first aid data, absolutely. How often a mental health first aid is being utilised? What types of interventions are they having to do? Again, we've got sickness. Utilisation of services is a great sort of indicator for how well a strategy and an ecosystem is being used. So how well are these things being used? How aware are people of them? Attitude and engagement. I think there's a few that kind of run along that line, where with psychological safety, attitudes, certainly, would be similar data points that you could capture. And there's a few comments here looking at kind of beyond kind of just sickness absence, but actually how many people have care responsibilities, how many people have actively managed health conditions that they're working with, and having to kind of overcome on the day-to-day, and the impact that has on their role as well. Protected characteristics, of course, legal obligations, another really, really important one to consider. And do the services that are being provided fulfill and ensure that those characteristics are protected and not discriminated against? Engagement with workplace health champions as well. Thank you. I think we've stopped typing now. And so, a range of things that you would want to know about your workforce before you build the system, right? And so, number one, are decisions data-driven? And so a few questions to reflect on for your own organization. Question number one, how much of our mental health strategy is driven by the evidence needs of employees? Number two, how often is clinical research used in the decision-making process? So when selecting a service, have we considered what the evidence needs of the employees are? Have we looked at what research sits behind, what the right intervention is for these things? Question three, are services offered appropriate for the type of workforce that we have? So looking at demographics, job roles, culture, organizational structure, shift patterns, are all these things taken into account? Are these important data points, as well as all the ones you've just listed as well? Are these being brought into the forefront of the conversation when we're looking at selecting services, when we're looking at positioning and creating a strategy? That first of all, have we identified the needs? Have we identified what the right intervention is for those needs? And do we know that that intervention works within the demographic that we have? So if you are a heavy industry, maybe changing shift patterns, risks of lone working, late night shifts, early morning shifts, out in all weathers, is the type of intervention that can be delivered suitable for somebody in one of those roles. And then on the other end, desk based, 9 to 5, hybrid working, sometimes from home, sometimes in the office. Are the services offered appropriate for that type of workforce? Really important questions to ask, as well as some of those brilliant points that were raised in the previous slide. And so certain things that you will need to know when building a mental health ecosystem are the prevalence of mental health conditions within your workforce. And that 1 in 6 is a good general number to work with, but do you have the capacity to get evidence elsewhere? And I don't mean in an intrusive way where, we're building, and there are certain workforces where it's necessary. For example, people who are armed in a security or policing role, it may be that they legally have to complete mental health assessments as a part of their role. I'm not saying that should be the standard, and I don't think it's appropriate to be the standard. But, we have an incumbent EAP provider, an incumbent occupational health provider. Are we using these resources to kind of get to gauge the current prevalence beyond kind of the guess at 1 in 6? And so not just how many people might be unwell, what types of conditions are we dealing with? How severe are these conditions? Because there is a huge mountain of difference between the type of intervention that needs to happen for a mild, self-manageable condition in its early stages of development and a more severe long-term condition someone's been living with for a number of years. We need to understand the risks relating to our industry. And so what do the outcomes look like across the industry and within the demographics who typically work in that industry? Not neglecting the minorities within those demographics, absolutely, but recognizing, within this industry, we may be very heavy male-oriented, for example. There may be more significant severe conditions within this particular demographic, or they may be at risk of certain issues because of an environment they're exposed to, because of the type of work they engage in. Perhaps it's a very loud environment and there's risk of hearing loss. Perhaps they are in an environment where there's sort of exposure to high stress and trauma. Again, one of my key industries I work with here at Thrive is the police, and that is always a risk that has to be recognised. And so looking at the industry, the workplace structure, and considering what risks they have, and if actually some of those risks are informing the types of conditions and severity that are occurring. And then on the human side, what do people actually like? What do people actually want? What do they have a positive perception of? Do people have a good perception of phone lines? Or actually, would they prefer a digital intervention? Or vice versa? Do you have a poor perception of apps and have a great perception of a bricks and mortar show up in person type of service to be delivered? It's also important to know, therefore, them if you have a range of providers, understanding exactly what they do deliver, and so to ensure that those preferences are met or desires are met, or if those preferences can't be met, understanding, are those preferences actually unrealistic? And do we need to do some education around what is realistic to expect from a service? Fundamentally, doing the data work will allow you to sit there and consider if services really do match needs, where gaps might be, where perception needs to change, and how we can connect people, perhaps despite a negative perception, to those services nonetheless. Ultimately, yeah, what I'm saying in a sentence is data is only powerful when we ask it the right questions. You can have all that data that you shared on the Slido and in the previous slides, but if we're not asking it the right questions and using it to identify gaps, using it to identify inefficiencies, then we can end up doing the wrong thing. And I'm not doing this to shame Amazon as a business, and this did happen in the past, perhaps when we were a bit more naive around delivering mental health interventions. But lots of research was done to try and identify stress within the workforce. Stress was identified, and in this response, which was quickly taken down by the organisation, a small windowless box was put into a warehouse for mental well-being. And people could go and do mindfulness. Mindfulness was not a popular intervention in this group particularly, and it kind of got nicknamed the despair closet. They gathered a lot of data, but unfortunately, they didn't ask the right questions of the data. They got the data and said, okay, people are stressed. Let's do something about that without diving deeper into what services are actually needed, what the right interventions are. And as a result, yes, a windowless box in a warehouse was the response to severe stress issues in the workforce. And so asking the right questions can help you avoid creating the despair closet. And so for many of you on the call, you'll have a range of providers. You may have an EAP, you may have occupational health, you may have procured specific mental health and counselling services. I'm aware of customers who have their own in-house mental health resource, or third parties. It may be that you've got private medical insurance, it may be you've got group income protection, it may be that you've got a cash plan and benefits platforms, and actually it could be that you've got 6 or 7 different providers. And so being aware of where those services overlap, where there might be points of friction, and actually being really clear about what each service does is going to be really important to help circumnavigate kind of that analysis paralysis that can happen when an ecosystem has been put together, where there's so many options you don't know where to turn, and there's a worry that if you go to the wrong one that doesn't provide that service, then you lose that individual. They have that negative experience, they take the step out to seek further help, they land in the wrong place, and then they withdraw completely because of the negative experience. And so, number one, being really aware of where services might overlap, being really aware of where they don't and what individual services do versus others. But then also recognizing that, is there a potential for some type of shared care? Is there a potential for inter-service signposting to ensure that if anybody takes that step to seek further help, that they land in a correct service eventually with their hand held through? And so rather than going to the wrong service, being turned down, being referred to NHS or whatever it might be, they can actually feel that, okay, this wrong step isn't a step in the wrong direction, it's a step towards getting the right direction. And so that's something that we've done some of at Thrive here, what we call shared care, where we build shared care protocols. And that can happen in a variety of means, be it us triaging and forwarding, in a more clinical way, people into already procured talking therapy services. It could be signposting within a digital platform, or it could actually be something else. And I'm going to share an example of how I feel a really good shared care and well-designed ecosystem can look. And so number one, we've got a situation where there's an employee who has moderately severe symptoms of depression. They have a demonstration of the Thrive service, and this is just a Thrive example, but you could substitute this out for EAP or PMI, whatever it is. They have a demonstration of a service which supports their mental health. And after that demonstration engagement session, they decide to sign up and take that step to get further support. They complete a mental health screening, and in the Thrive example, they're then paired with a Thrive therapist. During that initial assessment with their therapist, however, they do disclose that they've had some chronic back pain. And as a part of that discussion, they share how that back pain has really affected their mental health. That, they used to be part of a cycling club and a run club, and they can't do that right now. And they've lost that social lifeline. And how going to work, their chair just exacerbates the problem. And so they're struggling to concentrate at work, and they're making mistakes. And they're not as settled emotionally at work as they could be because of this constant pain. And as a result of this back pain, their mental health issues have started to develop. Now, in a well thought out signposting and shared care plan, we could agree through signposting, and Thrive can do this, and I'm sure other providers do this as well. I know of others that do, whether it's via the occupational health or whatever platform that the individuals come through, that actually agreed signposting can be programmed into this care pathway. So then the Thrive therapist actually is aware of that this individual has a PMI policy, which has access to physiotherapy sessions, and reminds and empowers the individual, well, you've got PMI, And actually, I can see on the list of things treated that there's physiotherapy available. So we'll deal with the mental health side. Here's the number. Here's the access. Here's the pathway into your PMI policy. And let's deal with this secondary or other aspect of your health in there. It's a simple thing, right? And actually, you'd think it would happen just naturally, but without, as an employer, as an organization, building this, all these pieces that you have will remain separated. And so through just agreeing signposting and shared care with your providers, and taking that step to ask, because it's not something that's necessarily always going to be directly offered, but in the very least, making a bit of a fuss and asking for that, whether it's done through a document, digitally. In the Thrive app, we can do it through signposting, building in those other supports wherever they reach out, so that if there is a secondary issue, they can be directed straight into there. A circular ecosystem that feeds others through interacting with one part. There we go. And so this kind of goes back to that point around communication and education, that it's not going to be possible to have everybody be fully aware of every resource, what they all do, what they're qualified for, because that's such a big task. But it is worth it wondering, as an organisation, what more you can do, and considering how well services are promoted. Is the communication about what those services do specifically ambiguous, or is it really clear? Is the qualification criteria clear? Are the types of interventions these services can do made, as a part of the communication? If someone goes into an EAP with a severe condition, the likelihood is the EAP won't be able to support them, and that's not because the EAP's done anything wrong. It's just the EAP is set up for a very specific group of individuals through its short-term talking therapies and counselling solutions. And so what we don't want is, in our communication, is to make it seem like this solution deals with everything if it doesn't. And so, number one, promote services in a way which makes it clear what they're for, and secondly, how to access them. And with that is, how easy is it to access information to reach these services? Does an employee have to go through a process that risks de-anonymizing their own healthcare, their own health issues? Do they have to speak to a manager to get referred into a service? Do they have to, ask a particular person to get access to something? Is that necessarily the best way of doing it? In some cases, it may be necessary for things like occupational health referrals. But in other scenarios, actually, how can we open up access to these services as much as possible, while empowering people to feel that their help seeking is private and anonymous and confidential? And so when promoting services, there's a range of things we need to consider. Firstly, when do we want people to access this service? Is this service an early intervention tool? Is this actually to use when you're in crisis? And then ensuring that when we promote these services, we're doing it in a way which highlights how we want that service to work. Number two, we need to consider when people actually will access these services. Is the service just a 9 to 5 available service? Is it 24/7? Is it not open at weekends? We need to make sure that we are advertising these services in a way which encourages people to use them when they're actually on and available. And so therefore, considering, as a part of this ecosystem and strategy, are policies around treatment access during work hours well published? Are people aware that they can take time off for healthcare appointments? Do they see their counselling appointment as lesser to a GP appointment and therefore worry about asking time off? Or is the requesting time off for a health appointment process invasive enough that the individuals don't feel comfortable asking that question? Do they feel that they're going to de-anonymise their healthcare issues through the current strategy in place? Thirdly, are there any psychoeducation opportunities available? Can this help employees recognise when they need support? Something we do a lot of here at Thrive, and we did have a number of people join us today who would just love the Thrive webinars and wanted to be here. Psychoeducation is one of the best ways that we can engage people in services. Research shows that following a stressful or traumatic incident in the workplace, people who are offered psychoeducation rapidly after it are far more likely to seek further help and complete that help. So not drop out midway through treatment. And so psychoeducation plays a huge role. And if you've gathered a lot of data, you can recognize what some of those key issues are and build psychoeducation into the working day in a way which promotes these services as a part of that psychoeducation. And so if you're going to do a session on sleep for your workforce, as a part of it, build in what resources you have available for sleep, whether they are external services, internal services. And lastly, it kind of, again, feeds into the same as the psychoeducation. Is there methods in place whereby the recognition of stressful incidences, a debrief after a significant change or accident in the workforce, whatever it might be, are those things happening? First of all, is there effective debrief? Is there effective one-to-one? Do these debriefs and post-incident reports take individuals into self-management services? Are we using these spikes in the data of either stressful instances or peaks in absence to understand why those absences are happening? If you're an accounting firm and every March is absolutely chocker with stress because it's financial year end, are we using that educated reckoning data and planning psychoeducation and debriefs and intervention before those incidents are going to kick in? And so one thing I've seen, which really impressed me around this conversation of helping people access services quickly without de-anonymization, without giving up kind of their private information that they might not want to give, is what I've seen as kind of what I've called an employee mental health flowchart. I've heard it called the golden thread of help before, and other kind of gimmicky names as well. But actually, as well as psychoeducation and all those regular service promotions that we can do in employee comms platforms, something like a interactive guide within an intranet, within your benefits platform pages, where you're not just doing a summary of what the resource is and a link to a flyer and an access code. What you're actually doing is taking an individual through a flowchart to help them land at the right resource straight away. They don't have to sit there and weigh up, should I use Thrive? Should I use EAP? What about occupational health? Should they be involved? I'm not sure where to turn. Actually, we can take them through a range of flowchart questions that bring them to the right services. And so here's, a start of a flowchart, where actually the individual comes in looking for support, and rather than just a list of options, it's, number one, have you completed a mental health screening? i.e., do you know what symptoms you might have? Do you know what you're experiencing? No? Okay, well, no. If you're a Thrive customer, download the Thrive app and complete the daily checkup and do the assessments. So then they'll go back to the start. Now they've completed the screening, yes. Okay, well, do you have symptoms of a mental health condition as a result of that? Yes, I do. Okay, well, if yes, are they milder symptoms? Are they more moderate to severe symptoms? The milder symptoms might take them down a pathway of self-management in the Thrive app and talking therapy and counselling via EAP. Click here to access now. If they're more moderate to severe symptoms, it may be respond to the Thrive proactive triage, engage with the Thrive therapists. If it's actually no symptoms, then it may be engage with Thrive assessment to maintain good mental health and keep on top of prevention, resilience building, etc. And I found organizations that use this type of approach to promoting their services have far better uptake, because it's really clear and obvious what resource needs to be used, and better outcomes because the person has gone to the right intervention at the first time of trying. They haven't had to go into the wrong one, come out, and either pluck up the courage to try again and deal with the rejection that they perceive, even if the rejection was the right thing to do. And it's from my experience, a far cleaner and clearer experience. It doesn't necessarily require going to a manager. It doesn't require getting advice from somebody who might not know themselves. And that's one of the key reasons why this type of platform works so well. employees and managers, generally speaking, are not clinicians. I know a few. Who do have psychologists, etc., within the workforce. But typically speaking, employees who are seeking help and managers who might be giving them advice are not clinicians. Often they won't know the difference between a Thrive, an EAP, a PMI, an occupational health, and an income protection, and all the things they offer. And if that individual, as I said, picks the wrong one, they can feel neglected, ignored, helpless, and maybe unwilling to take that step again. And if they feel that way, the likelihood of a condition worsening, becoming more severe, moving them out of the workforce either temporarily or permanently, grows significantly. And so well-designed flowcharts do take that mystery out of support, and they help people access the right tools quicker. They can be interactive, and depending on the type of platforms you've got to work with, I've seen some really well-polished, amazing ones where it's interactive. You click and then you work through it. Even the very least, just in a static image can work really well as well. And as a part of kind of that conclusion to the flowchart, policy documents being made available. In fact, some organizations I've seen using AI platforms where they'll upload the policy documents into a secure, internally approved AI platform, have the AI glean the types of support available, how it's accessed, quickly summarize the types of support it delivers, and build that into the flowchart. In fact, you can even probably build the whole thing with AI if you were savvy enough and gave it the right prompts. So ultimately, they work so well because they're easy to navigate, they give effective steps, they empower people to understand the extent of the service offering they've got, and they circumnavigate this issue of not being a clinician and not knowing what the right tool is. So I highly recommend. And if you're interested in what some of these look like, I do have some mock-ups as well, and you can get in touch with us, and I'll put details at the end of the session of how to do that. And I guess to kind of close off this section of the presentation before I move into some more Thrive-centric examples, last year I was lucky enough to attend the Mad World event, Make a Difference World, which is all focused around workplace well-being, mental health, one of the bigger events, I would say, on this topic. And one of the keynote speeches and panel events was the future of EAP. And they had leaders from the EAP Association, and from EAPs themselves. And the conclusion that entire panel came to was that the future of EAP, as the session was called, but as I would say the future of workplace mental health generally, revolves around evolving and creating effective mental health ecosystems, and that greater cooperation between services and employers is going to be the greatest transformation in employee mental health. That if as an employer, as a procurer of services, you can get these services talking to each other, and we can more effectively present these services to our people, that the likelihood of help being taken up is going to increase. The positive outcomes from that help seeking is going to increase, and as a result, the health of the workforce is going to improve. And I truly believe that is the case, and I've seen it in my time here at Thrive. I've worked with many customers for half a decade and seen a fundamental transformation in the way that mental health services are accessed, promoted, and those help acceptance rates ever increase as a result of bringing these services together. Now, if you are a current Thrive customer and you're sat there thinking, well, how can Thrive help this? All sorts of ways. In particular, the way that we signpost and the way that our therapists work, we know is a great front door to services generally. The Thrive app is very accessible. People seem to enjoy it. It's easy to navigate. And so by building in around this ethos of reaching out to people wherever they might be, whatever circumstances they're in, we can act as a really powerful front door to services that might be harder to promote. It's not always easy to promote a complex insurance product. It's not always easy to promote PMI, tools that maybe actually can do loads and loads of things. And so having an effective front door, which has a team of people who are dedicated to getting you to the right help, is a really powerful thing to have. And we're pleased to be able to provide that at Thrive. And so as you will well know, I'm sure, that the way that the Thrive model works is using digital and human and the best of both. Using clinicians who are accredited, who are in-house, that we have the ability to deliver clinical supervision and quality assessments and control with, alongside digital solutions that ensure that we can detect those symptoms quickly and we can get people into the right source of help. And that might be our own therapists. It might actually be advising them to take up the EAP offer. It might be actually referring them to some of the insurance products they might have if their rehab tools are going to be a more appropriate intervention. While typically speaking, Thrive tends to be one of the most appropriate interventions because of the breadth of support that we offer, from mild all the way up to severe. It certainly works best within an ecosystem where actually maybe the issue does require occupational health support. Maybe it does require another third party coming in. And certainly working in tandem with these products rather than working against them, working together and highlighting where this person might need some workplace adjustments and therefore recommending OH outreach, slots into our current model really well of proactive support, therapy based on need, and ensuring the individual has access to as much help as possible. Now, we do that through our screening and intervening, primarily delivered through mental health assessments, which often takes that first step of the mental health ecosystem flowchart, getting someone to be aware of their condition. Describing a pathway to somebody who doesn't know what they need can actually be kind of irrelevant at times. It's just giving them more and more information and setting up more and more uncertainty. And so we feel that having Thrive at the front of a mental health ecosystem, where they're going in there completing mental health screenings, not only helps that individual understand the symptoms they've got and therefore be more prepared to be able to receive the right type of intervention, but as an organization, we can then provide fully anonymized aggregated data, which then helps you collect more and more data to strengthen the ecosystem as over time as more and more people use it. The more and more data we can collect anonymously and feed back into the organization, the more and more steps you can take as an organization to use that data smartly. And the research supports this approach of screening and intervening, that if we can get people to work through a mental health screening, understand the symptoms they've got, they are more likely to access support. They're more likely to catch symptoms earlier, and they're more likely to improve utilization within services that may typically have lower utilization. And so, we feel the research supports this approach of screening, triaging, and then directing either into in-house services or external services. Obviously, at Thrive, we have our chat and therapy service, which is a great option for people. And if you'd like to learn a bit more about it, if you don't have access to this service currently, feel free to reach out. And again, we'll put details in the chat for how to do that. But the chat and therapy service is an ideal spot to be able to not only arrange with your therapist therapy, to go through some of those assessments, but also actually it is a good place to reflect on some of those other health issues that might be causing issues, and to get that direction and support to reach out for further help through other providers as well. And obviously with that comes Thrive's in-app support as well, either through signposting, where we can program signposts into the app itself. And so at any time, people can find their policies and they can find access to their insurances they might have. And they could even, within some providers, we have self-referral into occupational health built into Thrive's functionality. We have the phone numbers of EAPs built into the functionality, mental health first aider networks, email addresses, anything you could consider that might be effective, we can build into that process so that the individual, from a software perspective, has tools they can work on. They can self-manage conditions. They can support a therapy journey. They can build up resilience and prevent, but also that in-app functionality opens up the doors to a wide range of treatment that can be well clarified, that can be connected to the right phone lines, etc. So that actually Thrive being the front door enables organizations to stack up effective signposting and enable those individuals to then go and further access services because they started with Thrive. And so that support is not exclusively therapy and signposting. As said, we have a range of resources within the app itself that individuals can work on at their own pace. So maybe for those individuals who've worked through the flowchart and landed at mild, reminders to work through Thrive CBT courses, or our brand newly launched applied relaxation course, kind of a very unique intervention for anxiety. And actually building some of these sessions and awareness of them into some of those flowcharts can drive engagement in the Thrive platform. And again, recomplete that circle of engagement. Oh, I've come in for applied relaxation. Oh, I recommend to do a screening. Let me do that. Oh, actually, it recommends I reach out to occupational health. Let me click the button. And so if you haven't used Thrive before and you do have access to it, you can scan the QR code on the screen. You will need an access code, which usually will be held within your benefits, occupational health, human resources, or somewhere on your intranet if you need to find it. If you're struggling to find it, you can reach out our client support email, which will appear in the chat at the conclusion of this session, which is rapidly approaching. But we have got a couple of minutes. So I thought what I would do, I can see there has been some activity in the chat, and so I'm going to run through and see if there are any questions or queries that have come through along the way. I think there's been a few points for the Slido have come through, and yes, certainly PowerPoint slides will be available, PDF will be available afterwards, and yeah, I think that kind of touches on most of the questions. In terms of supplying the email to get access to the slides, or if you'd like to ask any questions or queries. I don't know if my glamorous colleague today, Ella, is able to put, there we go, help@thrive.uk.com. There we go. Yeah, thank you, Ella, for putting that in. Yes, I'm happy to hang around for another minute or two if there are any further questions. I can see a question from somebody now. Not sure there's a problem with my app/ account, but it only shows a diary for some reason. That may be it may be that at the top of the screen you have a goal which is called Welcome to Thrive Mental Wellbeing or something like that. In which case you'll need to complete that goal. With our recent update adding applied relaxation, there's kind of a new onboarding journey to sort people into the right categories. So give that a go, and if that doesn't work for you, reach out at the help@Thrive email and we can get that sorted for you. And yes, thanks for confirming. Yeah, the slides will be available in the PDF as well. If there's no further questions, then I'm very happy to close off the session there. First of all, thank you all for joining. I'm just actually going to break that off quickly. Is there a code you need to put in to access the app? There will be. If you reach out to the help@Thrive email that's been put in the chat, you should be able to. We can get you the right access code. We'll ask you a few questions to get you the right code. Yes, but otherwise, yeah. Thank you all for joining today. I hope it's been a really useful and engaging session. And that these PDFs are useful to you. And yeah, please, if you've got thoughts, queries, ideas, or would love to see some of the stuff we've done to engage workforces, don't hesitate to get in touch by the email provided. We'll share the slides and the recording as well. And thank you for the well wishes with the baby. I'm going to run and check on my wife and see how she's doing. And we'll close the session off there.